tongue diagnosis in Chinese medicine, and this will be part 1. So in the following weeks we'll have part 2 and 3 of tongue diagnosis to dive more into this important aspect of diagnosing in Chinese medicine. So that'll be the first half hour, followed by a half hour of my usual Qigong practice. So join me whenever you can, either live or in the recording. And if you have any questions, comments, concerns, this is my contact info on the screen. So feel free to text at that number or email me at that email address. And if you don't know me, my name again is Michelle Morisi. I am a licensed acupuncturist and practitioner of Chinese medicine, and I practice in the Rhode Island area and also in over the border in Massachusetts as well. So let's get started. So yeah, if any questions or comments come up as we go along, just feel free to contact me at that information, and this will also be available on Wu Healing's YouTube channel as well. So Intro to Tongue Diagnosis Part 1. Let's get started. So if you watched my videos on pulse diagnosis in Chinese medicine, then you may remember there are 4 ways of examining a patient in Chinese medicine, 4 main ways. And if you haven't seen those videos on pulse, you can also find that on Wu Healing's YouTube channel. So if you just search for Introduction to Pulse Diagnosis, you should find those videos, or reach out if you're having trouble. So the 4 main ways of examining a patient include looking at them. So this could be looking at their body, at their complexion, their body language, and also, of course, looking at their tongue. And hopefully they are not sticking it out in the way that this person is. We'll get into that later. But yeah, want the tongue to be kind of relaxed when you're looking at it. And then the other way of examining a patient is by listening to them and smelling, picking up on any scent, body odor, or just the natural scent of the person. By inquiry, so asking questions. Typically when I do my intake with a patient for Chinese medicine, we go through all the body systems and any symptoms that people may have, and then through touch. So that might be palpating the channels or meridians, or the different areas of the body, and then of course through listening to the pulse. So today we'll start to talk about looking at the tongue. So first of all, why look at the tongue? So the tongue is an internal organ that we can see easily, right? You just need to open your mouth to be able to show your tongue. And in Chinese medicine, it's seen as a microcosm of the body. So if you've ever had reflexology, or you've ever had ear acupuncture, there's a lot of, in Chinese medicine, of creating microcosms or recognizing microcosms of broader things. So the way that the different areas of the feet connect with the whole body. Same thing with the ear. There's a whole map of the body that's been applied to the ear. And so with the tongue, different areas of the tongue are associated with different organs and parts of the body. And it also shows the health of the body overall and different patterns, as they're called in Chinese medicine, of disharmony that may be underlying people's symptoms. And so, yeah, you can assess all the major organs or zang fu and substances of the body through the tongue. So, zang being what are seen as the yin organs, they're usually the solid organs, and the fu are the yang organs, typically hollow, but not always. And the substances of the body include qi, which is translated as energy, shui, blood, which is not necessarily just that red substance that comes out if you cut yourself. It has more functionality than what is assigned to blood in Western medicine thought. Jin Ye refers to body fluids, and then the yin energy and yang energy, which kind of encapsulates everything. So if you need to brush up on these things, you can go back to my pulse videos. We talk a little bit more about those body substances and energies. So we're going to move on now to what a healthy tongue looks like. So, typically you will see a healthy tongue in babies, hopefully. So this baby pictured here, you can take a look at the tongue. It looks like this tongue, she is holding a little bit of tension in the tongue, but typically it would be a little like rounder. But it just looks like the way she's holding her tongue, it looks a little like tapered at the end, but I don't think that's a sign of disharmony as it might be in someone else whose tongue is just more frozen in that state. So anyway, we look at the color, the texture, the movement of the tongue, the moisture, what's referred to as the coating, as well as the underside of the tongue and the veins under the tongue. So typically a healthy tongue is kind of pink in color. It's moist, neither dry nor wet, and lively without being kind of out of control or stiff. It's has a liveliness to it. It's not just flopping out of the mouth, and it's somewhat in the person's control. And then there's a thin, what's referred to as a thin white coating over the tongue. So this tongue has a thin white coat, and you can see there's like a little bit of moisture. It's kind of pink in color. So this would be, what you'd look at for a healthy tongue: color, coating, moisture. And it can be harder to tell with a picture, especially depending on the lighting. It's always best to look in person, especially as you're learning, but pictures can definitely be helpful too for learning. And so what gives the tongue its healthy qualities are the yin energy gives the tongue its substance, the yang gives it its structure and mobility, the shui or blood gives it moisture, healthy color, and fullness, and qi gives it energy and helps maintain appropriate thickness and shape. And this is a map of the organs and which areas of the tongue are associated with each major organ. And you can also more broadly just look at the 3 areas of the tongue being associated with each of the jiao, or areas of the body. So this is reversed. Sorry about that. This is incorrect. So this is the upper jiao. This should say upper jiao, the lung and the heart, and over on the side, it's the abbreviation key for each of these organs. So the upper jiao is associated with the lung and the heart. The middle jiao associated with the spleen, stomach, liver, and gallbladder. And the lower jiao, this is incorrect, this should say lower jiao, is associated with the kidneys, bladder, large intestine, and small intestine, with the main focus on the kidneys. So this would be like the root of the tongue, where it's attached to the mouth. This would be the tip of the tongue, the upper jiao. And there's different thought about the sides of the tongue in the middle being associated with the liver, or the some say that the left side is associated with the liver and the right with the gallbladder, or vice versa. Typically, I just think of the liver when I look at the sides of the tongue, but these two organs are brother and sister organs, so they work closely together, or yin and yang pair of organs. So typically we're considering the yin organs, which would be the liver, the spleen, the lung, the heart, and the kidneys. Those are the more vital organs, and again, I talk more about that in my pulse videos. Another note here about the inaccuracy of this tongue map. This it should be centered, the circle in the middle jiao. It looks like the liver side is narrower than the gallbladder side, but that's just that's an inaccuracy. It should be equal on each side. So the middle, the very middle of the tongue is associated with the stomach, and on the edges of that is associated with the spleen. And then, as I said, either side typically associated with the liver, and towards the tip associated with the lung, and the very tip is associated with the heart. So we'll talk about each different major quality of the tongue that we look at in tongue diagnosis. So first of all, as I was saying, with the color of the tongue itself, so looking past the coating, if there is a coating on the tongue, to kind of the overall color of the tongue body. A healthy tongue is usually pink in color. An imbalanced tongue could vary anywhere from a pale coloring to a deep purple. It could be red, a bright red, a purplish red, a pale red. It could be something called dusky, which is kind of a bluish tinge to the tongue, or peachy, which is kind of like an orangey tinge, all the way to a darker purple color. So any of those colors indicate different imbalances. And we'll get more into what these imbalances indicate in future videos, but just to start paying attention, looking at the color of the tongue and associating it with one of these shades to get started. And then next we'll talk about the shape of the tongue. So a healthy tongue is smooth edged, and so looking back at this baby's tongue, right, you see the edges of the tongue here are smooth. A rounded tip, so looking at this tongue map again, a rounded tip, and a proportionate thickness. So what that means is taking into account the size of the person, Are they someone of big stature? Is it a small child? Is it a smaller framed person? So just like with the pulse, we expect a pulse that's kind of feels proportionate in size to the person, or an artery that feels proportionate in size to the person. We're not going to have the same standard for a 6'5" man versus a 5' woman for the size of their tongue. But if if there is imbalance, the tongue will look kind of disproportionately sized. So it could be really thin, even flat looking. On the other hand, it could be puffy and or swollen, which is swollen tends to refer to an excess in the width, versus puffy is kind of an excess in the height, or the vertical shape of the tongue, and versus narrow or tapered. So a tongue that looks like it is not wide enough, or it could kind of be coming to a point at the end rather than a rounded tip. And then taking a look to see if it's what's called scalloped. And this is very common to see scalloping or teeth marks on the edges of the tongue. And so it's literally from the tongue pressing into the sides of the teeth, and that kind of molds the tongue to a different shape. So that's pretty common in at least the people that I see. My tongue has a bit of scalloping on it. This is, and we'll get more into it, but this is indicative of spleen qi deficiency that then leads to dampness. So a lot of us tend to be spleen qi deficient, especially with the low quality of our food and the high stress that we hold. So we'll get more into that later, like I said. Moving on to the moisture of the tongue, you want a tongue that is has some moisture without being really wet or dry. So just noticing that, and so you want to look at a tongue, when someone has not just run a marathon, or has not just is not in a really dehydrated state, but just kind of in their normal state, to see the moisture of the tongue. And next, the texture. So simply seeing whether the tongue is smooth or cracked. So this would be on top of the tongue. You might see most typically a crack down the middle, just right down the middle of the tongue. So going back to this, right, this is a smooth texture of the tongue. But as people age, they tend to get this crack down the middle of the tongue. Sometimes people have little kind of more horizontal crevices along the surface of the tongue. That's like a less severe version of the crack in the tongue. And then coating, tongue coating, which also might be referred to as fur or moss. It's just that coating on the surface of the tongue, if there even is one. So in health, there will be a thin kind of white coating. So it's, I think it's easier to see by looking at a lot of people's tongues and seeing people who don't have a coating versus they do have a coating that's thicker or that has a different color to it. But it's almost like an unnoticeable thing because it's just what's healthy. So if someone has an underlying disharmony, it may present as a thick coating that could be still white in color, or it could be yellow, gray, brown, or even kind of black. More typical to see white or yellow coatings. Brown or black is a more severe condition. And there could be no coating, so that's can be called peeled. So it just, like it sounds like, it's almost like a grape without a skinned grape, if you will. And it could also be a patchy coating, so there are like pieces of the coating missing. That's more rare. It's called the geographic coat. It can sometimes be hereditary. And then there's also a greasy coating, kind of a slimy quality to the coating that unsurprisingly is associated with dampness or phlegm in the system. And then we'll look at movement of the tongue. So this is, again, it's the more you look at tongues, the easier it is to identify these qualities. But in health, the tongue is lively, but it's not out of control. Like some people, their tongue is just trembling. It's moving in a way that they just can't get a hold of it. So you might see a slight tremble to the tongue. You might see a really tremulous tongue, like a leaf shaking in the wind. Or on the other end, it could be really stiff and a lack of movement. Or more severe, a tongue that deviates to the left or the right. So rather than just like coming straight out of the mouth, the tongue is clearly swerving toward the left or right, and would typically be stiff in that position, not like it's just swerving one way and then the other. And that's actually a sign of, in Chinese medicine, would be called wind stroke, or in Western medicine, simply a stroke. So that is actually, I think that's included in signs to look for if someone is having a stroke. So definitely if you see someone whose tongue is doing that, get help. And Dr. Wu would say I believe he would say if you know how to do tuina on the wind line, to do that to increase the blood flow to and from the brain. So definitely emergency if you see that last one, the tongue deviating to the left or the right. More common to see a tremulous tongue. That's a sign usually of a spleen Qi deficiency. So like I was saying before, a really common thing in our culture. And lastly, I think this is the last aspect that we look at on the tongue. Sometimes it's hard for people to show the underside of their tongue, but if you can see the underside, you take a look at the veins. Also, you can look at the color of the tongue underneath. It typically will match the tongue color on the top surface. And the veins in health will be kind of blend in color and be pretty thin. You should be able to kind of see them, whereas if it's a swollen or kind of flabby tongue, you may not be able to see the veins. So in health, you'll be able to see thin pink sublingual veins. Imbalanced would be to see, it's almost like varicose veins, but under the tongue. So it's indicative of some kind of stagnation. So less severe would be like a bluish color, slightly distended or swollen veins. More severe would be thicker, more distended, purplish, dark veins. Sometimes one vein, there's veins on the left and right side. Sometimes one side is more swollen than the other. Sometimes there's just one spot that's really clumped. So just take a look at where the veins are distended, what side, and the color. And some tips for when you are observing the tongue, whether it's your own or it's friends or family or patients, is I tend to ask people, open your mouth as wide as comfortably possible and just let your tongue hang out. So don't forcefully stick it out. It's not like you're at the dentist and you have to say, ah. You just kind of let it fall out. And that is the best way to observe kind of the tongue in its natural shape and movement. So if they're forcefully sticking the tongue out, like in that first picture, the tongue may look kind of stiffer or a different shape than it would if it were to just be hanging out naturally from the mouth. Ideally, you want to look at the tongue when someone has not just had a strongly colored food, drink, or medicine. So the coffee can give it a kind of yellowish tinge. Of course, turmeric can give it a yellowish tinge. Candy can change the color. So usually if you do see a coating that looks odd to you, doesn't look natural, you can ask the person if they've just had or eaten something, and they might have a swish of water to wash it away. But we typically tell people to avoid directly brushing the tongue before viewing, as that can actually brush off coating that's naturally there. And also, in this modern age, we have to take into account the effect of medications or medical treatments that definitely contribute to the shape and color and all those qualities of the tongue. It's still informative of how, of the patterns going on in the person's body. But rather than thinking, oh, it's something to do with the diet or something to do with the lifestyle or the climate the person is in, which can all affect a person's health, it could be more so from, for example, antibiotics. They tend to be cooling. They might give someone like a thick white coating on the tongue. Radiation, of course, is heating, may cause someone's tongue to be redder and drier than it would have normally been. So you want to take into account person's health history and medications they're on, and that can help to inform what's going on and what you're seeing on the tongue. And we will get more into what all those different indications mean. So stay tuned. In parts 2 and 3, we will look at how major patterns of disharmony present on the tongue and what all those signs mean. And once again, my name is Michelle Morisi. I'm a licensed acupuncturist and practitioner of Chinese medicine. And please feel free to reach out at my number listed there.